Dr. Fauci, it is my great honor and privilege to be able to talk to you today and really to speak to you tonight in support of the honor you're receiving from Research America, the Outstanding Achievement in Public Health Award. The heavens know, the angels rejoice. Nobody deserves it more than you. And I have been looking forward to speaking to you. First of all, are you just worn out by all of this?
In some respects, yes, but in some respects, no, because the enormity of the problem that we're facing, it kind of puts you in a zone, Oprah, where you don't feel the fatigue, even though you know it's there. It's kind of like when you're taking care of a very sick patient
Yeah.
and you're exhausted, you don't recognize the exhaustion because the task at hand is too important.
Well, it used to be, I think for a lot of people, when they have to go, their body knows you have to keep going. And then the slightest amount of relief comes like a vacation or, something that lets them know that you don't have to be on all the time. And a lot of people get sick. That used to happen to me, is that I do shows. And then the moment I have a vacation, my body would just go, collapse. Has that happened to you?
No, it hasn't, because I haven't had the opportunity to go,
Yet.
yeah.
Well, do you see that? I can let go a little bit. Is that in the future somehow?
I think so, because if you look at what's going on right now, the fact that we have very highly effective vaccines right now, and we've really done a very good job of getting vaccines into people's arms. Ever since President Biden took office, we've had a real escalation of the implementation of the vaccine. We have now 1/3 of the adult population is completely vaccinated. 50% of the adult population has at least one dose. And the deaths and hospitalizations, particularly in the elderly, is coming way down. They were the most vulnerable, obviously. You remember in the beginning of the outbreak, the
Absolutely.
terrible toll of death, particularly in nursing homes, that's gone down 75, 85%.
Well, the Research America Board of Directors voted unanimously to honor you today with the Outstanding Achievement in Public Health Award. I would like to know, who would you like to thank for helping us all get through this past year?
Well, there are a lot of people, but there's one group, Oprah, that really stands out in really very bright light on this, and that is the healthcare workers, the doctors, the nurses, the other healthcare providers, who have literally worn themselves down on conditions that are unimaginable. And they are truly the heroes and the heroines of this, so much so that we all owe them a real deep debt of gratitude. The other is, the scientists who've been working for decades to advance the science to be able to get a vaccine in record time. It's truly unprecedented that we went from discovering the virus in January of 2020 to having a vaccine that's going into the arms of people 11 months later. 5-10 years ago, that would have taken 6-7 years to do that. Yeah. And it was done in 11 months, not because we rushed it, not because we cut corners, but because of the extraordinary investment that was made in basic and clinical research.
Well, you've quickly become the most well-known scientist in the world. You've made being a scientist feel like a hip thing, and undoubtedly raised the awareness for the importance of not only your work, but the work of so many others in your field. I just am curious, and I'm sure a lot of other people watching us are curious, when you were growing up, who did you look up to and admire that sparked your desire to be who and where you are right now?
Well, it depends on the age frame. when I was a really youngster, I would look up for athletes, growing up in New York City with the Brooklyn Dodgers and the New York Yankees. That was my aspirational goal. But when I got more serious about the kinds of things that I wanted to do, it was a combination of, heroes in the field of health, like Louis Pasteur, the very famous French scientist who really transformed how we think about microbes, but also figures that were leaders. I mean, the idea of leadership has always been something that I have been fascinated with, about how you can get your skills and your character to be a highly ethical leader with a high degree of integrity. For example, I read a lot about and really loved the history of General Dwight D. Eisenhower and subsequently President Dwight D. Eisenhower. I was in medical school when John F. Kennedy became president, and that was something that we all looked to him as really a turning around of passing, the task to a younger generation. So those are the things that inspired me a lot. But then once I got into medical school, it was just, inspiration of what the field of medicine is. I fell in love with it. I came from a classics background. In my high school and college, I was trained by the Jesuit priests, and it was very heavily steeped in the classics, the humanities, philosophy, Greek, Latin, ancient history. So I became very much attuned to the civilizations and the impact of things like diseases on civilizations. And that's why I chose medicine and public health.
Well, as scientific knowledge continues to build, the advice based on science understandably changes also. So how do you respond to those people who find the information that they are receiving, and at the rate that we're receiving it, confusing, or are skeptical about following the directions from scientific leaders such as yourself? Because you've had your share of pushback. And
Sure.
I just got to say, I so admire your integrity, big word for me, and I know for you, how you stand so calmly in the center of the storm all around you. But what do you say to all of those people who are confused by the messaging?
Well, their confusion sometimes, in fact, often is understandable. And what I try to do is explain that sometimes they think, understandably so, that science is static, that if you have a static situation that doesn't change, then it's very easy to understand it, you absorb it, it's immutable. But what we're dealing with is a rapidly evolving situation when on day one in January of 2020, we had no idea what the heck was going on. We thought we had a virus that jumped from an animal to a human, that didn't spread from human to human. Then we found out that it did spread. Then we found out it is spread very efficiently. Then we found out that people who had no symptoms at all were spreading the virus. So that really forced us, as the weeks and months went by, to modify what we were saying and what our recommendations were. And if you're in the background looking at that, you say, why do they keep changing? I think it's a lack of appreciation that science and knowledge, particularly in an evolving pandemic, is a very dynamic process. It's not static. And once they grasp that, they can understand how things change and how you have to change with the knowledge that you get.
Okay, so that brings us to this question. You were talking about how rapidly things are changing. What did we learn from the rapid spread of this pandemic that will better equip us for the future?
Yeah, I think it confirmed to everybody now when we were saying that pandemics have occurred throughout history. Sometimes corporate memory forgets them. We, in I wouldn't say our generation, but certainly my father, who was 8 years old at the time of the pandemic of 1918. And that was so much of a thing in the past, you forget the extraordinary potential of destruction, suffering, and death that an outbreak can do. And now all of a sudden, we have lived through history. You and I, we've lived through history, because 100 years from now, people are going to be writing about the pandemic of 2020, 2021. So what we're learning is you've got to be prepared in a way that isn't just lip service, but really serious preparation at the global health level and at the scientific level.
So COVID-19 has harmed, as we know, indiscriminately racial and ethnic minorities have been disproportionately impacted. And beyond COVID-19, as we all know, such disparities have been a reality for many, many years. And if you could recommend one tangible step, Dr. Fauci, in the research of public health arena that would produce a measurable gain against disparities, what would that be?
Yeah, it would be something that when you say it is sometimes controversial, but when you look at the disparities in health, be it the lack of access to the kind of care and the kind of access to the things that protect you from getting infected, and you look at the social determinants of health that make it so much more likely for a Black and brown person to have diabetes, hypertension, heart disease, which makes them much more susceptible to the severe outcome of COVID-19. The reason why it's not racial at all, why Black and brown people, they get more serious disease, they get more hospitalizations, and they die more frequently from COVID-19. It all is based in the social determinants of health, which quite frankly gets down to one word, and that is racism. I mean, the racism in society that has kept brown and Black people from having access economically and otherwise to the things that go back decades and decades. So if we're going to fix it, Oprah, we need to make a commitment right now that we're going to make a decades-long commitment to erasing that kind of racism that puts brown and Black people in a position where they're so vulnerable to a thing like an outbreak.
I think it's so crucial what you said. It's not racial. It's not because of the color of your skin. It's because it's not racial. It's racism that does it. Okay. So once we're finally on the other side of all of this, and when do you think that final is going to be actually?
You know, I think it's not going to be final for a while, but it'll be close to normal. I hope by the end of this year, if we get enough people vaccinated and we get the level of infection very, very low. But there's one big caveat, Oprah, and that is a global pandemic requires a global response. Because even if we suppress the level of infection to very low in our own country, and Canada does it and the European Union does it, as long as there is dynamics of infection in low and middle income countries, there will always be the threat of variants and mutants coming from there back to this country. So we've got to take care of the entire world, not just our country.
So yes, I wanted to ask you, so is what's happening in India right now concern for the rest of the world?
Absolutely, totally and completely. The same thing in sub-Saharan Africa.
So we can't say that's them over there and we're clear and we're okay. So we can go out and party or do whatever. Now,
viral pandemics don't have passports. They go wherever they want to go.
Yeah.
They go wherever they want to go.
So what's happening in India now can have an impact on us months later.
Well, yeah, what happens if you don't control infection, you get variants. And even though our vaccines are highly protective now with the virus that's in our country now, there is the possibility that you would generate a variant in another country that would come here, and then we'd have to start all over again with getting boosters for vaccines and things like that. So we've got to address this as a global issue where we all stick together as a global community.
Okay, I just got to ask you, did you grow up having thick skin or did you develop thick skin, a thicker skin, as you became a part of the public, in the public eye? Because what you managed coming at you from all directions this year, I mean, I just have to say, you've been stellar inside yourself, centered inside yourself.
Well, I fundamentally grew up with, I would say, a degree of tolerance. I grew up in the streets of New York City. So that's something in and of itself. When I came here to the NIH, I realized that if you were going to concentrate on the things that are really important there are a couple of things you don't get influenced by. You don't get influenced by the adulation, which you get almost because you become a symbol. Most of the people who have the idolization of me don't really know me, but I stand up for something for them, which I feel good about. I stand up for the truth and being honest and being forthright, but also you can't get intimidated or distracted by the completely radical people who hate you. And it's disturbing, but you can't let it bother you, because there are a lot of people out there who are really vehemently hate me for what I stand for, like I'm taking away their liberty because I'm telling them to wear a mask.
Yes, and you withstood that so beautifully recently, hearing you testify before Congress. Were you thinking a bunch of expletives in your head when you were going through that? I wanted to see a little bubble above your head, actually.
Well, if you right, exactly, you'd see all those X's and exclamation marks. Yes, but I controlled myself.
You managed to control yourself. So once we're on the other side, what will be, do you believe, the most important step as a nation and the world that we take to heal?
Yeah, well, there's a couple of types of healing. There's the appreciation of the potential for such an outbreak, and also to do the kind of preparation of being able to prepare and respond. But the thing that has bothered me as deeply as the medical issues, Oprah, is the extraordinary degree of divisiveness in our country, which transcends health issues. It's just, how can we function as a nation that's is the most incredible country that was ever established? How can we continue to be a great country if we have extraordinary, vehement divisiveness among us? That just we've got to heal that before we go anywhere, and that's the thing that bothers me a lot.
Okay, so everybody in the world wants to honor you. You could be Man of the Year every day somewhere in the United States and the world. So for you to receive this award for outstanding achievement in public health, what does this mean to you?
Well, it means a lot to me because it is within an environment and a group of people that are my peers. And as there's a certain something about being recognized by your peers, the people you work with, the people who you respect very much, and the people you know. So that's why it's extra special, meaningful to me.
Well, so deserving, so well deserved. I want a longer conversation so we can sit down and talk about all that's in that bubble. Okay, at another time. Congratulations, Dr. Fauci. So
thank you very much, Oprah. I really appreciate you doing this. Thank you.
Thank you. Thank you.